The intensive care unit of the MUHC has been inundated over the last 2 years. They care for the patients who are the most sick and the most vulnerable, including more recently patients with severe COVID-19 infections. Every year, the ICU at the MUHC admits about 1,800 patients. And for context, in 2021, there were only 20 days with no COVID patients. One of the patients they helped save is Dr. Howard Goldstein. He joins me now to share his story. Thank you so much for joining us today.
Thank you very much for inviting me.
So, Dr. Goldstein, you suffered a heart attack, one that is called, quite frighteningly, a widowmaker. Why do doctors refer to it that way?
Because the likelihood of dying after having a blocked artery in that location is extremely high. So the chance that I survived was quite miraculous indeed, and probably because I was minutes away from a hospital before and was able to be taken care of.
So, let's talk about that heart attack. What do you remember about it?
I was sitting in bed reading a newspaper on a Sunday morning, started having the classic tremendous pressure and pain on my chest, like many people thinking it's just a little gas. When it didn't go away, I realized there must be something going on. I asked for Urgence Santé to be called by my wife. They arrived very shortly after, threw me in the ambulance, and off I went. I had, because of my experience, had a look at my cardiogram and realized I was having a heart attack. And probably no more than 3-4 minutes out from the hospital, I closed my eyes and then woke up in the ICU 2 weeks later.
Wow, that is absolutely incredible. You mentioned your experience. Tell us a little bit about your experience as a physician, Dr. Goldstein.
Well, I've been a physician since 1988. I worked initially at the Jewish General Hospital and currently, and in that context, I worked in emergency rooms, worked on the floors, worked in the family practice clinic, did obstetrics early in my career, did chronic care institutions and home visits early in my career. And then last 10 years, I migrated to a clinic downtown.
I'm sure a lot of people wonder what it's like to be a doctor in the position of being a patient. What was that like for you?
Oh, that's a great question. It's a two-sided coin. In one respect, it's scary to know what you know and how bad it could be in the context every time somebody's giving you some information, what the results of a report is or what they're planning on doing to you. On the other hand, because my friends and family who were at the hospital at the time, actually just like my friends, I don't think I would have survived had they all not jumped together in the emergency room and said, we're not letting this guy die. And some of my friends who spoke daily to the ICU staff were like, how's he doing? What can you do better? What can we do differently to keep this guy going? And it was just awesome. I mean, that's the benefit of having friends who are doctors.
We are speaking with Dr. Howard Goldstein, and we're talking about the intensive care unit at the MUHC. So you mentioned, and it just gives, shivers up my spine. You say you closed your eyes in the ambulance and you woke up 2 weeks later in the ICU. Tell us about what the ICU was like for you.
Well, first of all, it's a surreal experience because you're disoriented when you open your eyes for the first time. You're hooked up to every wire and tube that you can possibly have. You don't know where you are or what happened to you. And more so, this was in the time of COVID. So they weren't even in their current location. They were all struggling to work in a alternate location that was given to them during the COVID experience. And everybody's rushing around trying to help, trying to orient me, trying to explain to me what's been happening, and you get this all at once within half an hour period of time, and it was overwhelming.
Wow. I mean, we talk about the intensive care unit. This is really the beating heart of the hospital. It's where the sickest patients go. It's where everybody there is fighting for your life. What did you think of the care and that you received and the staff that were there?
Oh my God, it was outstanding. I mean, again, we all remember the beginning of the pandemic. My heart attack occurred
Hmm.
April 2020, and they were overwhelmed with work, and yet they never stopped to not take time with me. They're amazing people. They're amazing caregivers, and it's a shame that most people forget the fact that the ICU is, as you said, the backbone of the heartbeat of the hospital. Everything goes on when a critically ill patient is admitted. They could be admitted to surgery, they could be admitted to cardiology, they could be admitted to any other service, but usually they spend some time in the ICU, or frequently spend some time in the ICU, and people forget about that. And these guys work so hard.
You have a mechanical heart now, and you're waiting for a heart transplant. Tell us a little bit about what that's like.
Oh, that's both a bonus and a disadvantage. My life is obviously much better to be able to spend time still with my family. It's added time that I didn't think I would have. But I'm attached to a basically a messenger bag with batteries and a control panel to that mechanical heart. The wire attached through me through a little hole in my stomach, and it's about maybe 2 feet long. So, going to sleep with that is not difficult. Wearing it around my shoulder on the messenger bag is always causing pain, and taking
Mm.
a shower is complicated. So it's not easy, but it's still better than the alternative.
And have they given you any idea of when you'll be able to get your new heart? I imagine that's a daily hope for you.
That is a daily hope. It's been about a year or so since I've been on the transplant list, and like anything, donors are far and few between. So I believe right now, currently in Quebec, there's about 38 people waiting for a heart, but everybody has a special They have a different type of blood. They have a different type of antibodies they produce against other hearts. And there's also the size of my chest cage. Right? If I get a 280-pound football player who wants to donate their heart for me, it just won't fit. I'm only 5'3". So until the right heart comes along, that's what the artificial heart is there for. It's in order to keep me alive until we make the right match. And there's no way I'll know that until the time comes. I get a phone call, off I go to the hospital. Could be tomorrow, could be 2 years from now.
Wow, incredible. We are speaking with Dr. Howard Goldstein. We are talking about the MUHC Foundation and the ICU. Dr. Goldstein, you know, because you've been an intense part of the preparation for this campaign, the MUHC Foundation has just launched a $150,000 fundraising campaign to help the ICU with training new staff and to support the mental and physical well being of the current staff. Why did you want to give back in this way? Why did you want to be involved?
I'm so grateful for what they did for me and how they took care of me. If it wasn't for the staff, obviously physicians, nurses, and all auxiliary services, that includes radiology and orderlies and so on, I wouldn't be here. Yes, I continue to be grateful for the cardiologists and cardiac surgeons and nurses who continue to care for me. There's still multiple specialists involved in my care, but I wouldn't be there. I wouldn't be visiting my cardiologist and cardiac surgeon monthly if it wasn't for the care of the ICU staff. How much better can I do in thanking them by trying to help them in this foundation campaign?
So we've got an MUHC Foundation goal of $150,000. You have launched your own personal fundraising page to contribute to this $150,000. And you're doing very, very well, Dr. Goldstein. It seems a lot of people enjoy supporting you.
I'm very grateful for my friendships once again. So if they're not physicians, I'm just so happy that they're making donations in my honor.
What do you think it is about your story that is inspiring people to give and to listen to how incredibly, how incredible the staff are at the ICU, incredibly dedicated, incredibly compassionate?
Well, I mean, first of all, medical problems of any sort, but most especially heart attacks, can occur to anybody at any time. And, people have this vision of, oh, I had a heart attack, I went to the emergency room, I spent a day in hospital, and then I went home. Well, that doesn't always occur. And more often than not, and certainly in this world of COVID, so many people are admitted into the ICU now. They have to realize that it's an integral part, it's an important part. And without that, a lot of people would be dying, including myself. So I'm so happy that these people are there to support the hospital and most especially to have supported me.
Your final thoughts on the ICU, Dr. Goldstein, as we wrap up our time today. What do you want to say to encourage people to contribute to this campaign, to contribute to your campaign, what we're trying to achieve for the staff at the ICU at the MUHC? What are your final thoughts?
Please give and give generously. These people are special. These people are awesome. They help the hospital and help your family members, and they help you to survive and to live. They have given me the opportunity to allow myself to attend two of my daughter's weddings. I just learned that
Oh.
one of my daughter is pregnant, so that makes me yet another special occasion in my life I would have missed. I see my son having a new girlfriend, and of course, every day I see my wife. So the same thing can happen to anybody out there. And if you want to spend time with your family for many more years to come, in case you ever get in the situation that I was in, God forbid. But if you are, these people are there to care for you. Please give generously.
A beautiful and hopeful note to end on. Dr. Goldstein, I want to thank you so much for joining us on Health Matters today.
You're very welcome, and thank you so much for the interview.
Dr. Howard Goldstein, thank you so much for joining us on the show. The MUHC Foundation has just launched a $150,000 fundraising campaign to help the ICU with training new staff and to support the mental and physical well-being of the current staff. If you would like to learn more, head to www.muhcfoundation.com.